Hello and welcome to your Pharmacology Clear and Simple, Chapter 18, Pulmonary Systems Medication. Our learning objectives for this lecture are to define key terms, describe how the respiratory system functions to exchange oxygen and carbon dioxide, discuss the actions of mast cell stabilizers, bronchodilators, anticholinergics, xanthins, and beta-androgenic agonists used in treatment of asthma and other respiratory disorders. Describe two medications that may be used to treat viral respiratory illness. Compare and contrast antitussives and expectorant medications and when each is appropriate to use. Discuss tuberculosis, TB, and how it is treated. The pulmonary system is responsible for respiration. It works in conjunction with the musculoskeletal system to achieve the following functions. The diaphragm contracts, compressing the lungs, which expel carbon dioxide through the bronchial tubes and trachea and out of the mouth and into the air. This is expiration. The now mostly empty lungs inhale oxygen from the air, so breathing in, and this is inspiration. The brain regulates the rate and depth of breathing depending on the needs of the body, and the exchange of carbon dioxide and oxygen occurs at the level of alveoli. These are tiny air sacs in the lungs. So the diaphragm here is a large muscle under the stomach, and then you can't see very well because it's smaller, but the alveoli are the tiny sacs. And as we said, the brain regulates the rate and depth of breathing. Dyspnea is difficulty breathing. This is caused by asthma, tuberculosis, chronic obstructive pulmonary disease, COPD, or other diseases. And we talked about this during our pulmonary chapter in ALH 4 when we actually built the respiratory system out of clay or Play-Doh. That was fun, wasn't it? All right, let's move on. Our comprehension checkpoint number 1. This is where the exchange of oxygen and carbon dioxide takes place. Is it A, B, C, or D? And just for fun, I'm going to have you go ahead and write this down and bring it to class. So get a notebook, start a page, and write comprehension checkpoint number 1, and then give me your answer. I will collect it during ALH 4, and you can include all 4 comprehension checks. So let's look at pulmonary medications. Pulmonary medications are determined by which part of the pulmonary system is affected, and some medications can liquefy secretions, and others actually dry them up. Some act locally, whereas others act systemically on the system. So mast cell stabilizers. These inhibit allergy cells from releasing substances that cause inflammation. They prevent or decrease occurrence of asthma attacks, but they do not help acute attack. They are administered via metered dose inhalers, MDIs, nebulizers, or intranasal. And when we have our discussion during our second semester about medication administration via inhalation, we'll learn more about MDIs, and we've already worked on nebulizers, and then we'll also talk about the intranasal. So antitussives, and so sometimes you'll hear antitussives because of tussin. Sometimes I've heard it also as antitussives. But antitussives stop coughs by blocking the cough reflex. If a cough is dry and thus not productive, an antitussive will allow the patient to rest, especially at night. And when secretions are present, expectorants make the secretion thinner, increasing the body's ability to clear the lungs and upper airway. So we'll move on to expectorants here. And again, they increase the ability to clear lungs and upper airway of secretions, and that's because they thin them. So guaifenesin would be one. Over the counter, you've heard of probably Mucinex or Robitussin. These are given by mouth as syrup, tablet, or capsule. Antibiotics. So many respiratory illnesses are caused or accompanied by bacterial infection. So antibiotics are prescribed to combat or prevent the infections as appropriate. One bacterium in particular, the Mycobacterium tuberculosis, causes the highly contagious infection tuberculosis, which is TB. Tubercules remain in patients' bodies for a lifetime and can be reactivated if not treated. Many patients with immunologic disorders such as AIDS can die of TB, and TB is treated with a combination of up to 4 antibiotics for 6 to 12 months. So it is a long, hard treatment for patients. One of these antibiotics used to treat it is rifampin, and it's important to note that rifampin turns tears, urine, perspiration, and other bodily fluids orange or yellow in color. Why do you think that would be important to know and educate your patient? Yep, that's right. They might be kind of freaking out if they didn't know that that was a side effect. So latent TB is infected with TB but does not have the disease. So that a patient, if it's latent in a patient, they're infected but they don't have the disease. The treatment prevents development of this disease at some point later in life and is not considered contagious. Antiviral medications are used to prevent the growth of virus and are usually administered to decrease the duration of a viral illness or minimize the symptoms. So it doesn't actually, like with a antibiotic, it can treat a bacterial infection, but with the antiviral, they're actually preventing more growth of that virus. So it typically minimizes symptoms and speeds up the healing time. Ribavirin is an example, and it is as a continuous aerosol treatment. It's used for about 3 to 5 days. There are serious side effects with exposure, so it's important to educate visitors and healthcare workers because there is a risk to developing fetuses, and it can cause damage to contact lenses. Anti-influenza agents can help ease the signs and symptoms of influenza, but they do not cure influenza or prevent the spread of the virus. The virus can be prevented by receiving the annual flu vaccine, but that's a tricky thing because every year when they make the flu vaccine, they have to predict what strains they should put in there. And so if another strain comes out or you are infected with a strain of virus that's not covered in the vaccine, then you still end up with influenza. Zanamivir is a medication, anti-influenza agent that is given. It can be inhaled. Bronchodilators relieve acute bronchospasms and include anticholinergics, xanthine, adrenergic agonists. They relax the smooth muscle of the bronchi, allowing the patient to breathe more easily. That brings us to comprehension checkpoint number 2. The type of medication that suppresses cough is write that down, Looking at xanthins, these relax smooth muscles and relieve bronchospasm. They're used most commonly to treat asthma. You will see IV theophylline given as a continuous infusion in serious asthma attacks. Also, they can come in oral forms such as aminophylline. Looking now at beta-adrenergic agonists, they stimulate beta, the 2 receptor sites, which results in a bronchial dilation. Some examples of short-acting agents that are used on an as-needed basis are albuterol and metoprolol. An example of a long-acting agent is salmeterol. And epinephrine or adrenaline can be given in a subcutaneous injection in the case of severe dyspnea associated with asthma. Our medical terminology, dys without pnea is breathing. So in severe cases where they're having severe difficulty breathing, so like without breath. And that brings us already to comprehension checkpoint number 3. Xanthins are examples of which type of drug? Go ahead and write that down. Moving on to nasal decongestants. Decongestants cause the blood vessels in the nasal mucous membrane to constrict, thus reducing nasal passage drainage. Nasal decongestants must only be used for short term to avoid the rebound congestion problems. Because decongestants are mixed with other drugs and cold and allergy remedies, care should be taken with acetaminophen and ibuprofen to avoid overdoses. It's also important to note here that decongestants are not for use in children younger than the age of 2. That brings us to glucocorticoids, and glucocorticoids suppress the immune system, and this means that the inflammation is decreased and it makes breathing easier because of this suppression. They should only be used for the short term because of the suppression of the immune system that occurs when taking. So it's standard with the glucocorticoids to take the smallest dose for the shortest period of time possible. Budesonide is an example of a glucocorticoid that is taken as oral or inhalation for prophylaxis to prevent asthma attacks. Methylprednisolone can be used for treatment of severe acute asthma attacks. This is a steroid. And again, it's important they're only taken for short periods because they do suppress the immune system. Mucolytics. These liquefy very thick lung secretions, and so the secretions can be excreted through coughing. They are commonly used in patients with cystic fibrosis who are at an increased risk of pneumonia if they do not remove these secretions. Cystic fibrosis is a genetic disease causing very thick secretions, including respiratory and other organ secretions. Oxygen is used as therapy for hypoxia. Chronic uses include management of COPD. Acute use is needed to treat dyspnea and carbon monoxide poisoning. Oxygen can be delivered via the nasal cannula, mask, endotracheal tube, a hood, or a tent. Oxygen is considered a drug, and therefore it does need to be ordered by the physician. And when we administer it, we need to follow our 3 med checks and our 7 rights and administer it as a drug. Looking again at COPD, these COPD patients retain the carbon dioxide, which leads to higher levels of carbon dioxide and lower levels of oxygen. Normally, healthy patients breathe in response to rising carbon dioxide levels. COPD patients breathe in response to lower oxygen levels. So it's important to note if a COPD patient is given too much oxygen, it could stop their breathing. Which brings us to our final comprehension check. Comprehension check 4. If high levels of oxygen